I wanted to test out what happens when we put electricity into the blood, if anything. If nothing worked, I'd still be happy getting my PhD for a failure. But it worked, and it worked. I'll show you. Oh, so what you're looking at, a single drop of capillary blood, right? Supposed to be 5 million red blood cells. So you can tell we are zoomed in a lot because this is not 5 million, right? On the left here, I told you blood should be what pH? Optimal. Yes. What millivolt charge? Yes. We know that this is discharged. More than that, we know this is reverse polarity. How do we know that? Because there's no negative charge sitting on the outside of the red blood cell. Negative repels negative. The cardiologists call it Zeta potential. It's a measurement of negative charge. The negative charge, when it gets super discharged or polarity reversed, it saves whatever negative charge it can on the inside of the cell. Now, we know there's no such thing as a positive charge. How do we know that? Because positive repels positive, but these are not repelled. Is that making sense? There is no positive charge. It's just different levels of discharge. More severe, more severe, more severe. Okay, so I took 4 patients. 2 of them were vaccinated. 2 of them were not. All of them were considered healthy by Western medicine. Does this look healthy?
No.
Cardiovascular disease, #1 killer in the world. All 4 participants.